Well, let's talk more about the evacuation of those premature babies, 31 of which have been moved from the Al-Shifa Hospital. Laila Baker joins us. She's the regional director for the Arab states in the UNFPA. That's the UN Agency for Sexual and Reproductive Health. Laila, thanks for speaking to France 24 today. I'd like to start with the top story. 31 premature infants finally evacuated from Al-Shifa. Walk us through the risks of moving babies who are in such a delicate condition as these 31 premature infants were.
First of all, before I can walk you through that, perhaps you'll allow me just a little leeway to explain how desperate the situation is, that those 31 babies were born prematurely in a hospital that has been besieged, bombarded, and illegally attacked, so that the women who were bearing those children, oftentimes giving birth without anesthesia or adequate health care, had to do so in El Shifa. They were scrambling for their life to begin with. An evacuation also, it assumes that you can go from one place to another safely with the requisite services that you need at the end of the line. These babies have been moved while they are in dire condition, in urgent need of medical care, regular, stable incubators and facilities to feed them, provide them with oxygen. They are moved under conditions that not only jeopardize their life, but are in complete breach of any human act, and certainly in breach of international humanitarian law. I cannot put myself in the place of any of those poor parents or the medical personnel who've been bombarded in Shifa, the decisions that they've had to make.
Absolutely, Leda. Horrendous decisions that needing to be made by those parents there. You heard in that report, I mean, the fact that more and more babies are being born prematurely in Gaza, given those horrible conditions that you've just described and the lack of medication there. 50,000 women are currently pregnant in Gaza. Those are the figures that we have. What more can you tell us about the numbers of women who are giving birth? Is it 180 a day? What can you tell us?
It's very difficult to give you the exact figure with
Of
so
course.
much displacement. We estimate, though, on current figures, that around 50,000 pregnant women are now in Gaza, many of them huddled in unhygienic, overcrowded, displaced shelters. Many of those shelters are subject also to the bombardment and certainly to the harassment and the difficult circumstances that have been imposed on them as a result of the Israeli bombardment for the last 42 days. Many of the hospitals that are supposed to be a place of protection, refuge, care for the ill, the sick, the injured, and certainly for any woman seeking health care, they have been turned into a death trap. We have had difficulty in even finding many of the women to provide them with the care and the medical aid and some of the emergency humanitarian aid that UNFPA is so keen to deliver to the most vulnerable women. Now, over 1 million people in the south of Gaza. We're unable even to reach those in the north. We require unhindered access in a safe environment. That requires 100% ceasefire, not a pause, not a corridor. We require a ceasefire. The people of Gaza, the Palestinians who are there, the civilians who are there, require that ceasefire now. Without that, I fear for the lives of the women and children and people of Gaza. It turned into a death trap.
Layla, talk to us about the lack of food. I mean, we're speaking about pregnant women, premature babies. Of course, having no food, having no water exacerbates a condition which is already unlivable.
You said it yourself. It is unlivable. It is inhumane to deprive an entire population of water. There is no clean water. We estimate that over 70% of the Gazan Palestinian population has no access to clean drinking water. Many of our people who are there, including staff members who work for UNFPA, have resorted to giving their children who are holed up in unhygienic, overcrowded centers brackish water, seawater, where they have also been sick. The United Nations, with UNFPA fully on board within that family, is trying desperately to reach those most vulnerable women and children and civilians there. We cannot, however, replace the civilian infrastructure that must be maintained. The hospitals, the schools, those are sanctuaries. When they are bombed, when the UN premises are not respected, that is a huge breach of international humanitarian law. It is inconceivable that someone would bomb and raid a center. Without the food and water, we fear for the lives of not only the 50,000 pregnant women, but all the young girls, all of the children who are now showing signs of malnutrition. I ask you, what will be their future?
Laila, a word from you on the medical teams in this. You heard in that report a UN member of staff saying, I'm humbled by the work that you're doing. Medics, nurses who are on the ground are working with nothing, no resources whatsoever.
They are nothing short of heroic. They have put their lives at risk to save others. They refuse to leave their ill, sick patients, to put a woman out while she's pregnant and not give her care, to where they will take care of the premature babies and do everything that they can to save that life. I think that the medical personnel who have been at Shifa Hospital and all of the Palestinian hospitals that are now under siege and attack are nothing short of heroes who respect the sanctity of life, and they are trying to preserve it the best that their profession has asked them to undertake. I hope and I urge and I beg of the international community and those who can bring this to a halt to please do everything that they can to bring a ceasefire and allow for those babies and those women to have a shred of hope and a chance of a future life.
All right, Laila Baker, you are Regional Director for Arab States in the UNFPA. Thank you very much for giving us insight today of the dire situation in Gaza currently. Thanks very much indeed.
Thank you.